In this video, I will demonstrate MFR, dynamic cupping and gua sha therapy, the methods to release the spasm. First step is palpation of the area where the spasm is. Just check it where the spasm is and then apply oil all over the area. While applying oil, you just palpate that area as well to feel that where the spasm is, where the nodules are, where the tightness is, where the tissue is short or where it is stretched out. You need to check with your hand along with applying the oil. While oil is there, your hand movement or any tool movement is very easy. And the next method is the actual method of doing myofascial release with the crossover hands. In this method, you have to cross the hands and move very slowly outwards, and then lift your hands and come back to the center. Again, move to the upper part of the spine. Just try to move with the inhalation of the patient. The inhalation will passively take your hands out. You don't have to move, but it will go on its own. Just try to feel that while the patient inhales, your hands moves out with the inhalation, and then lift it up, shift to the upper spine, and then again repeat the procedure. We are going from down to up from the spine. It will release all of the muscle spasm. These all methods are really relaxing for the patient, and the patient feels better because the spasm reduces, the pain reduces, and the drainage of the lymphatic fluid goes in the lymph nodes. The next method is cup your hands one on one and move from down to up on the spine. This will elongate the fascia underneath the spine and the person feels relaxed. As we are easy in the loose clothes, similarly our spine is easy with the loose fascia. Try to move till your occiput at the hair and skin junction. From down, we are progressing slowly and steadily with the breathing. Patient is breathing relaxed and moving up. Try to move while inhalation and go up till the hair and skin border. Myofascial release is something you have to be very patient to do it. The slow you progress, the better it is. Try to move very slowly from down to bottom along with the breathing or with the mobility of the tissue, and we can just switch it over either with the movement or with the breathing. Keep on palpating the tissue and feel where you have to progress, in which direction the spasm is, the direction is there where you have to progress. In the next method, I will be showing you the arm movement with the myofascial release. That means the person is going for horizontal arm extension in the abducted arm. See, the person is lifting the arm, and with the lift of the arm, my hand is progressing from proximal to distal area. That means from near to far area. Just have a look. Arm moves up along with the hand going outwards in the direction proximal to distal. Just have a look. It's really relaxing for the patient, and even the range of motion is increased after this therapy. The person feels very comfortable to raise the arm. Just see, with the arm movement, arm moves towards the roof and my hand is moving from the center of the spine to outwards from the shoulder area. The modifications we can do in this is just changing on the range of motion. Earlier I was doing at the 90-degree abduction area. Now we can go either 120-degree abduction, or we can reduce it to 30-degree abduction. Along with that, we are moving on the different muscles. As we know, the different ranges where the trapezius muscle works, we can move upper, middle, lower trapezius and function with the movement. We can move from the spine area to going outward on the desired muscle tissue, which is having the mobility along with the movement. Just see the arm moves, and along with the movement, how the hand is progressing from proximal to distal area. In the next method, now we are progressing. Another method to relax the myofascial tissue is by the dynamic cupping. We just vacuum in the cup and move the cup in the similar manner as we did our hand, from down to up, and try to move more in inhalation, and from down to up. Go up till the skin and hair line over there, occipital region. This will give a lot of relaxation to whole of your body. and just move with the cup slowly and gently so that the vacuum is maintained and it doesn't get lost. From down to up, you will feel after this the erythema is there, blood circulation increases, elongation of the tissue increases. It is kind of passive stretching for the short area. We can apply oil for more continuous grasping of the cup. It will give more vacuum maintenance if we apply oil over the skin. And remember, we are progressing from down to up. Anywhere where the pain is, we can progress. Dynamic cupping with the movement also can be done, like arm is moving and the cup is moving along with the movement of the arm. Different angles can be varied. 30-degree abduction, as I already told you, 90-degree abduction or 120-degree abduction. Any movement along with the muscular tissue which is moving, you can just progress from proximal to distal end. Keep on palpating the tissue, just feel where you have to go, and after the cupping, see how the relaxation is occur. Earlier the skin was hard, now you're feeling relaxed. Now we can palpate along with the MFR so that we can feel what the changes are there, how we have to progress, and is it working or not. It's really marvelous therapy. Person feels awesome relaxation after this. Modification to crossover hand therapy can be changed with the crossover cups. You can have two cups in your hands and then move in the same direction as the hands are moving, just holding the two cups from proximal to distal direction. We can move. Another very good relaxation is given by the gua sha therapy. Gua sha therapy is with the different gua sha tools. I've got 6 types of tools. You can choose any tool which makes your skin contact to the maximum and progress in the similar directions from proximal to distal. I'm progressing from the center of the spine, going towards the edge and going to the axillary region so that the lymphatic flow will go in such a way that it drains out in the lymph nodes at the axilla. We can move up till there, or we can go from proximal to distal end nearby. Gua sha therapy increases the blood flow to the maximum, and when the redness and the blood flow is there, the skin gets a lot of oxygen and a person feels relaxation as pain reduces with the circulation. This will increase the circulation. We can even mix it up with the movement of the neck or with the movement of the shoulder. We can do shoulder shrugs along with the gua sha therapy or head lift with the gua sha therapy. These all things will help to reduce the spasm at the neck region. Here I am demonstrating the movement of the shoulder shrug with the gua sha therapy. You can just look over. I'll advise the patient to do shoulder shrugs with the hands down, and when the person is lifting the shoulder up, my hands are moving from proximal to the distal directions. I'm moving from the neck to the shoulder with the movement of the shoulder shrug. And it can be mixed up with inhalation. While shoulder is up, ask the patient to inhale and move the gua sha tool from proximal to the distal direction. When the shoulder shrug is done, inhale and take it from neck region to the shoulder region. We can also replace it with the cupping of hands therapy, like you can crisscross your fingers and just progress from proximal to distal direction from the neck region to the shoulder region. This can be done along with the shoulder shrugs and in inhalation. In inhalation you move out, and then in exhalation lift it up and again place it on the neck region. From neck to the shoulder, move very slowly and gently, just release the spasm of the upper trapezius. With this you can even feel the difference in the spasm and check out whether the skin is relaxed or not. Keep on palpating. See, I'm palpating again and again just to check whether the results are coming good or not. In between you can do this another therapy of spinal pinching. In spinal pinching you can see where the spinal pinch, you can even just check from before and after the therapy. The pinch will be better. You can hold the skin better as it is elongated after the myofascial release therapy. You can progress again from lower spine to the upper spine. Just pinch it up. You can pinch and move, or pinch and release can also be done. Either movement or release. Just remember from lower spine to middle spine and then to the upper spine. This pinching can serve as a self-diagnosis that where the area you can pinch is got normal, and where it's very difficult to pinch out, that means that area is still stretched out and you need to go for myofascial release therapy at that area more. So see, I have found this area to be less in pinching, so I am again progressing with the myofascial release at the same area, and when I did that, the pinch grasp increased. I can do it more better after this. Repinching can be done to check the area of the culprit, and then again arm movement can be done with the myofascial release therapy. This arm movement and the release therapy can again release the tissue, and you can recheck that your pinch grasp increases after the release. Dynamic pinching is also good, and at the neck area you can even try out for static pinching. Just pinch that for a while, about 10 to 15 seconds of the continuous pinch, and then release. That will also give a lot of relaxation. If any headaches are there, just progress from down to up with the movement of the head. Here I am showing you the hand motion from down to up with the extension of the head. Person is lifting the head and I am moving from down to up. If any headaches are there, just move the thumbs from down to up till the occipital area and try to move it with the movement of the patient. Patient is lifting the head, extension of the head is going on along with the inhalation, and my hands are moving down to up. This breathing addition is also very effective, and person feels awesome relaxation after this. Thank you so much for watching. I hope you like the video, and please subscribe this channel for more informative videos in future. Thank you so much again.